And then we've got the Texas Chiropractic Association that's on the call here today. Just like Mitch, these individuals are also referral partners with Impact Health Sharing, but they're very passionate about what Impact Health Sharing is doing. And I'd love to have them share from their perspective, why it is that they are representing Impact Health Sharing. So I believe we have Dr. Tice Hergert, Dr. Steve Von Osdale, and also Dr. Clay Suggs on the call here today. Dr. Tice, we appreciate you guys being on here and love to turn it over to you and just share from your perspective, why it is that you guys are so excited about your partnership with Impact Health Sharing.
Well, thanks for having us on, Jeff. It's been a beautiful relationship, but you'll remember it didn't start out that way. You're talking about provider pushback. I get it, man. I kicked the tires on this and looked at every angle of it because, bottom line is providers are getting abused by the insurance company. It's like PTSD every time we have to quote negotiate with an insurance carrier, because there's no negotiation. It's a hostage. It's a terrorist situation. But we started looking at Impact. A good friend of mine, Dallas Trosper, shared Impact with me, and we'd had health shares as our family. We'd taken health shares as a medical clinic and a chiropractic clinic, and most of them were better. They were a better fit because you couldn't afford to pay the $38,000 in premiums for the XYZ carriers of the world. So it was a much better fit financially, but still, as a provider, you kind of get kicked around. So I took a look at it because Dallas actually, is an insurance agent. He sold us our last health insurance plan that we purchased, and so I said, well, if he's looking at this, then let's see what it looks like. And so what I saw is, like, you talk about transparency. You saw where everything was. We had a question about contracting. They put the head of their contracting division on the phone. I had a question that somebody didn't have the answer to. Oh, let's get the CEO, Phil Chrysler, on the phone. I'm like, what? Blue Cross didn't put their CEO on the phone with me ever. And I mean, it's really about the people and the community, and you could tell that. So I started as the credentialing process to become a provider. It took no time, a few days. The rates that were being paid are unheard of. I mean, it's a very fair market comparison. In fact, it's 3 times what one of the brand name insurance companies is paying me for the same services. So it's a win for a provider. From a patient standpoint, talk about it looks and feels like health insurance. I mean, it looks and feels like health insurance, but better, because it actually does what they say it's going to do. So I started sharing it with my friend Steve Van Osdale, who's part of the Texas Chiropractic Association. I'm a past president of the association. So for the association, for years, we've heard from our members, get us some affordable healthcare options, get us some insurance, group insurance. Well, when you do that, first of all, most companies won't even write a policy for a group. If they didn't do it prior to Obamacare. So just even having an option that members found a value to, there wasn't any. So I ran it by Steve. I said, Steve, what do you think? And so we went through this process of about 6 months of seeing, is this a viable option for TCA? And it was a win-win. And so Steve's on the call this morning. Steve, you tell what you saw.
Yeah, great. Thanks, Tice. So my job, I'm with the TCA. I'm the internal affairs coordinator, and my job there, I oversee several committees. Financial oversight, membership are the 2 big ones. When Dr. Herger brought this to my attention, like he said, hey, I think this may check off a couple of boxes for value to the membership, possibility to raise funds for the association. So I said, sure, let me see what you got. So I checked it out just like Dr. Herger did, inside out, top to bottom. And what I found was it worked, and it worked really, really well. It did definitely check off those 2 boxes. And so I took it to the to the board with my approval. They voted on it, and now we're affiliate partners with Impact. For me personally, I was able to previously work with a different company to provide insurance not only for my family but for my employees. Now, like Dr. Hergert, I don't like to mention any names, but I will tell you the company I used, their logo had a blue cross and a blue shield on it. So that gives you an idea. When I switched over to Impact, we saved $1,700 a month. That was huge for me personally, being a small business owner. I was able to repurpose that money and put it back into our business, and hire more people into the office, which tremendously helped us out. I see value with the members. Not only my patients get value out of Impact now that I've got patients that are taking advantage of this as well. We put this to work with the membership, with patients, and a good friend of mine, Dr. Clay Suggs, can tell you about the value he had as a member with Impact.
Hey guys, can you hear me? Am I on? Okay, just want to say, number one, thank you for bringing this to us. TCA saved me. My story started with a good buddy of mine. I've been in practice for chiropractic for 35 plus years. Good friend of mine, my best friend, had a stroke last year, which left him in ICU with no insurance for a week. Shortly after that, my mother-in-law had a heart attack. And my wife and I looked at each other and said, we don't even have any insurance. What if something happens to us? And so that was a reality check to us. So we started looking at health share and different things. I got a quote from United Healthcare for $1,100 a month just for me, $5,000 deductible. Didn't seem so wonderful to me. So we started looking outside the box again, and it just wasn't going anywhere. And then recently, at that time, TCA had just joined with Impact Health. And I started looking at that and started getting a quote with them. And wow, what a difference. I mean, it definitely kind of came way down for us. We got a quote of $540 for both of us. And it covered a lot more, did a lot more. So that was a savings to us. And then we started looking at it from a perspective of our patients and how that might work. And that was even better, because I've practiced chiropractic for 35 plus years. That's been my career. But I also looked at the impact that a partnership with this company could do and give us residual income. So that's also been a very enticing situation for us. And so we've grown, and we look at this as a very positive opportunity for a lot of people on this call. I like to make money, but I also like residual. And this is what's saved us and making us a lot of money. And I appreciate everybody's time. And hopefully you'll take a look at this. And back to you, Jeff.
Well, I appreciate all of you being on the call here today. Dr. Clay, I know that when you first looked at Impact, like many small business owners, you were, sticker shocked at the high price of health insurance and like, how can I find a way to lower my costs? I know you were looking at another healthcare sharing company at the time, took a look at Impact, saw even more value, saw even a significantly lesser expensive price than you had been getting quoted by that other healthcare sharing company. And, love the fact that, now this is something that you guys have rolled out to many of your members, and you guys are just big advocates of this Impact community. And you heard, him talk about residual income. So for those of you wondering, is there a business opportunity here as well? And the answer to that is yes. For those of you that after this call were like, hey, I want to know more about how can I refer this to other people, there is an opportunity to be a referral partner and earn residual income, just like Dr. Clay mentioned. Mitch had mentioned it as well, for referring Impact to other individuals, families, and small businesses that you know. So if that's you and you want to learn more about that piece, just get back to the person that invited you on the call and say, hey, I want to learn more about what this referral partner piece is all about. But for those of you that are looking for healthcare for yourself, for your family, for your small business, remember, if you're looking to be a member by November 1st, you have to complete that enrollment by 5 p.m. East Coast time on Thursday in order to be a member as of November 1st. Now,